The panel takes its starting point in what being black and trans or non-binary means in healthcare in general, as well as gender-affirming healthcare. The discussion will explore what changes need to be made to reduce barriers to access and interrogate racist structures within the healthcare system in Sweden. On one last note, this panel discussion is part of the anti-racist project called Dubbel Exponerat by Reclaim Pride and page 28. The project explores the intersections of being black, Jewish, Roma, Sami, and Muslim, and being queer. To find out more about this project, you can check out the social media. Once again, Reclaim Pride, page 28. I would like to welcome you to the stage. The floor is yours.
Welcome, everybody. I'm Kesiena.
I'm Essay.
I'm Andy.
We're really glad that you could join us here today for this panel discussion. So I guess we'll just dive right in.
Yeah, sure.
Yeah,
sure.
okay. So maybe we can start by talking a little bit about access to trans-related healthcare in Sweden, and a little bit about the long waiting times that people face accessing this kind of care, and the kind of impacts that this has on trans people who need this care for their physical and mental health. Maybe Esse, if you want to start, take it away.
Well, I think as many of us know in here, it does take a long time to get the adequate help that you need as a trans and non-binary person. Mostly because a lot of that also has to do with mental health issues and feeling like you need to also just talk to someone about how you feel and to properly get the help you need to do that. And if you're going to deal with your mental health and then also deal with the fact that you are a trans person or a non-binary person, it becomes double of that pressure on you to just basically understand what's going on with yourself. And so if you try to get trans healthcare, it does become like waiting double as much before you can get one of the other care, because you can't just get one medication for one thing and that fixes everything. But in order to go through this process, you need a doctor, and you need to be in a long-ass queue, and it's a whole project. It's like going through a maze. You never really know what turn will lead you to the right path, and so you go through these loops just trying to find the right person that can help you, and the system fails you constantly. And I think for me personally, that made me give up on the system, to not really fully trust the system, because as a black person you also don't feel included in the system, and it becomes all these layers of yourself that you just constantly have to accept. And in order to accept that, it's hard. It's hard a lot of times, and like I said, a lot of people give up because one system fails you and then the others just keep failing, and there's really no one to turn to, and it gets longer and longer and longer, and a lot of people never really get to that line where they meet the doctor or even go through hormone treatment, and a lot of people turn to self-medicating, which is a huge part of why the mental health also increases, because you may not be getting the right type of medication that you need, but you're self-medicating anything to get by. And I think, yeah, we're going to talk a lot about that as well, probably.
No, absolutely. Andy, is there something that you want to come in with?
Yeah, but sure. I also think, like, I mean, you talk about the community and like also the importance of community, and lack of community is kind of like the fact that, I mean, you don't get the healthcare treatment that you are looking for, and you're waiting, and you maybe feel lonely and you feel outside. So I think like the community care is so important. I mean, we talk about like self-care, but I would like more to talk about community care because it's like a
Definitely.
shared experience with other people as well. But also the thing of being both black and both trans, and that we touched, yeah, but the situation of not having really somewhere to go, maybe that could confirm your feelings and confirm your situations more than like the actual practical situation. Whereas maybe as a white trans person, you would feel more immediately, I don't know, like connected to other people in the trans community because it is more white since we're living in Sweden and all other aspects of it. So I think like the fact of being both black and trans is like, yeah, but then um, you're kind of left out to other communities, more like diverse communities. So like a black community, for example, but then also you have like maybe your family there, or you have other people there that is either supporting you or they are not supporting you. So it can be kind of complicated, I think, to be, yeah, to be that intersectional, or what to say. So yeah,
Feeling caught in the middle. Kind
yeah,
of.
exactly. Like mellanförskap, as you could say in Swedish, like really caught in the middle. Or yeah, what was the other word we talked about also?
Utanförskap.
Yeah, of course. Yeah,
like
being
exclusion, alienation, not fitting in, not having a space.
yeah.
Thank you, Andy. Hesse, did you want to come back to what Andy said?
No, I think you covered it pretty well. Feeling like you're in between is really difficult, especially when you're supposed to feel safe. It's the very space where you're supposed to claim. It's supposed to be your home, your whatever you want to call it, but there's a system that constantly puts you down, belittles you, and you have a society that just looks at you differently. When you go into a room, into an healthcare facility, you're instantly portrayed in the way that they have already built in their own head without really knowing you, without really asking, how can I help you? Rather, they've painted an idea and they go with that. And regardless of what you tell them, this is not me, this is not how I want to be portrayed. They still have that image that they've painted in their own head, and that suits them. And so trying to change that constantly is in itself a battle. And sometimes you're just too tired, so you give up.
Yeah, no, absolutely. And I think we also talked about like how some people are waiting years to access healthcare through the public health system. So then they're forced to turn to private matters, which is of course really expensive. And
Very expensive.
yeah, and is obviously not accessible for everyone. So then we get an unequal like healthcare coverage for trans people. We talked a little bit about the importance of having community and community support. I'm wondering where you guys personally turn to for that kind of community support, since it is harder to find in this context where, yeah, we're having double oppression, so to speak.
I think like, I mean, I'm from Malmö, I live in Malmö, and as a native Swede, or like a how do you say, like someone that is settled, I would say that it's kind of, it's multifaceted because in a way you have an urge to talk to people that also face the same kind of problems, but maybe also, we talked about that a little bit, me and a friend, that it can also feel kind of as a small problem to not be heard in one situation when someone some other person might just been having experience of coming here and need to get into the Swedish society, needs lawyer support, being a newcomer. So I think like we kind of need more communities, or not communities, more areas, more rooms for us to discuss these issues, because it is a difference if you have migrated background or if you don't have a migrated background. Yeah.
No, absolutely. I think that in Sweden, kind of being seen as a person of color is sometimes seen as being like equivalent to also having come to Sweden. But obviously there are a lot of people of color who are born here, who are Swedish from day one, and they're also needing support and community. Essay?
No, I think it's funny because I remember when I'm from Nigeria, and I at age 12 or somewhere around that age, I was made to move to Sweden. Obviously, it wasn't my choice. I would have not chosen a cold country like this. But when they told me I was going abroad, I instantly pictured the States. I pictured Italy. I pictured anywhere but Sweden. Honestly, Sweden was not a country I'd heard of. I'm not joking. I really wasn't taught geography about Europe. It was more other African countries. So when I got here and I was in this culture where people did not say hi to each other, where people, just passed you by, even if you're carrying 10 bags and you obviously need help. That to me was unheard of, because where I come from, you say hi to each other, you connect, there's a community even without saying the word community. So when I started learning Swedish and speaking Swedish, and my Swedish to people was fluent, which to me, I'm just trying to communicate so I can hear when you curse me. So I spoke Swedish and I imitated the people who were around me, which were mostly white people. And apparently I sounded like I was from Stockholm, my accent, and I'd never lived in Stockholm. And so I was like, okay, what does that mean? And people were like, du har liksom rikssvenska. And I was like, I don't understand.
Like, you have like proper Swedish.
Proper Swedish? What the hell was that? So I got this question a lot. Are you adopted? Were you born here? Me telling people that I learned Swedish in a couple of months was something they'd never heard of, because apparently you must struggle to learn the language. You must struggle to fit in. But not everyone has to struggle. Some people really do speak Swedish even if they've only been here a few months. It's not the hardest language. But when I would hear this question, at some point I just started replying, yes, I'm adopted. If it makes you feel better, whatever I say, you're not going to believe. Because if I tell you I'm from another country, then you want to know more about that country, because my skin tone already gives you a really clear picture of where that country is. Africa as a country. So I would get questions, oh, you're from Africa. I was like, it's a big continent, I'm not just from I don't represent the whole of Africa, but imagine how cool that would be. But here in Sweden, it was always a struggle to just feel like, yes, I am Swedish as well. Why can't I be Swedish? Why does my skin color tell you have to question me deeper? And so when they will look at I finally got the passport, and they're like, oh, du är svensk. I was like, yes, I am Swedish. They're like, but where are you from, really? And I'm like, oh, Sweden, Göteborg. And they're like, no, but really? And everyone's sitting here, we're laughing. We all know how this goes.
It's classic.
It's very classic, you to feel like you're interrogated. And until you tell them, oh, my father was from Lagos in Nigeria, the question doesn't stop. So I started playing along, and I would just be like, oh, yes, Värmland. I would name all these places I'd never even been to, just to give you an idea that there are black people here as well. For as long as there have been Sweden, black people have been here. For as long as we've existed, we've been everywhere. Same with trans, same with queer, gay, bisexual. We've been everywhere. We've just not always been in the front lines. We've not been the trailblazers that they publish out on papers, but they were trailblazers for this eras as well. And same in Sweden, because black people are everywhere. We are really everywhere, and I'm so proud of that. but it's hard to also find the people within that said community that share the same value as you, because not every black person is queer friendly. Not every black person will accept you with open arms, just like so it's
not
hard.
every queer person will accept you as a black
Exactly,
person.
exactly. So we have to find the right community. We talk a lot about community. What the fuck does that really mean?
Yeah, that's a good question.
I honestly don't know.
I'm
I'm
asking
trying. No, because every day I feel like I'm trying to find my community. Where do I belong? Who are my people? And then I walk in a room and I don't see anyone that looks like me. That also creates another layer of anxiety, because even though I love everyone in the room, they may not look like me. And there's also that feeling of not really having that shared experience. And then again, we talk about the black experience, but not every black person experiences the same thing.
No, absolutely not.
Definitely. But also I think like, yeah, I mean, what you say is like, for example, when I was going here in the morning, I was sitting on a bench and an older man came and sat next to me. And then like just before that, it was a lot of older people out there today.
They out there.
Yeah, our senior people. And another person came up, and sorry if I gender him as male, but elderly, and they kind of asked me, can I drop my Dramaten, like my bag with wheels, trolley by your side. And I was alone then. Yeah, the other person didn't come yet. So I was like, yeah, sure. Or he was. They were first asking me like, are you sitting here? And I was like, well, yeah, okay. And then the question came, can I drop my trolley here? And I was like, yeah, sure. And then they went in and did their groceries and came back to put the toilet paper and other stuff in the trolley. And I mean, who else would do that than someone that is perceived as a black man, a black elderly man? I mean, the thing of that, they felt more supported by putting their trolley next to me than, for example, ask someone in the store or to go with it into the store and roll it as all other elderly people do. But the thing of like being accused of stealing was something that was so accurate and so what do you say? Not wrong. Present in his mind. So they asked me instead, and I mean, the whole situation was, of course, like saying yes to a sibling. And I mean, for me, if I can prevent drama for them, of course I would say yes. No doubt. It's just so sad, and it's just so, yeah.
No, totally.
Yeah.
I think we will move on. Andy, you are studying to be a nurse right now.
Yes.
Yes, so I thought I would ask you a little bit about that.
Could be why senior people come to me also. I don't know why.
That friendly, nurturing spirit.
Yes.
This could be the time. Ask a black nurse whatever you want to ask a black nurse. Because
yeah, so I'm just wondering a little bit about what the nursing program is teaching you guys about trans-related healthcare, and then also healthcare related to like dermatology and skin conditions on people with darker skin tones, and how that's what is your experiences of this?
Well, yeah, as we pre-talked about, is that, I mean, not much in the nursing education is focusing on either trans or bodies that is not male or female, and definitely not on darker skin or black skin or melanin skin. So there actually a doctor whose name is Amna Emilas that was writing a book called Melanin Rich Skin, which focusing on skin diseases on black skin, and hopefully that could be something that could be support in the education as like course literature, and yeah. But I mean, what can I say? It is so like I don't find words for like so much lack of information and education that is like really helpful for us to actually meet people in the society and come out and being able to have like real talks and real understanding, which leads to that if you don't have your personal experience of different things, you will probably not really be very professional or be very sleek in meeting people outside the norms. And that could be kind of anything, I think, because if you have experience of minority stress, I think also you kind of relate. But of course, the more experience you have, the easier it will get, of course, to meet someone in front of you. So, like, I was in a job at talk. I was looking for a job and job interview, and they kind of asked me, and I said something, and they're like, "Oh, so you're specialized in wounds?" And I'm like, "Well, no, I'm not. I'm not excellent with wounds." And then I had to think about, but what am I excellent in? And I was like, it just felt such small and like pity to say that my expert is actually communication and to understand and make the patient feel comfortable. But it is such a thing that is very hard to touch. So it's so much easier to say like, well, I'm super good with the machines, with the to do the injections or something like that. But I mean, I think I'm overall in most of the tasks that we do. But what I'm really good is the understanding of someone that is not feeling well and have some kind of, we talk a lot about suffering, lidelse, and that should be as much valued, but I don't think it is. I think you're really stepping like over it. So I think, to answer the question is that we need to talk about real humans, about I mean humans like yeah, of skin, of blood, of everything we are.
Yeah, I mean, I'm also thinking about how it can be like a hostile learning environment to go into a program where you feel like your experiences are not attended to by the healthcare system, to think that my identity as a black person or a trans person is not even worth a PowerPoint lecture. Like, this does not engender a great feeling of comfort or make you feel like this is a place where you want to be and want to drag yourself out of bed every morning for that 8 a.m. lecture and to like stay in the program and to get this education, which then means that we have a healthcare profession that is lacking in black people and lacking in trans people. And this only perpetuates the cycle further and further. It sucks.
For sure.
Oh.
For sure, for sure. Yeah. And also, like, as you also talked about the thing that, I mean, where to go in healthcare. I mean, it means that you kind of like support, and when you do feel like mentally broken down or distressed or whatever, where do you go? Both for me as, I mean, a healthcare provider, I also need to have my, to reset and have my like ways of getting energy back, but also, of course, as any patient, as any person.
Yeah, I think it's interesting you mentioned your specialty being communication. I think it should be a specialty all professionals in whatever branch you work with, especially when it comes to healthcare and meeting other people. I think it should be a specialty that is mandatory to learn and to properly learn, because communicating is, we take that for granted. We all automatically assume that people in these professions are really good at communicating, but they're sometimes the ones that need to learn how to properly communicate. The healthcare is supposed to make you feel safe. When you're sick, you want to trust the person that is giving you this healthcare, whatever reason it is that you're there for. But in my experiences, those are the coldest rooms. Those are the places where I've felt more alone, where I felt like, damn, I really don't belong here. Fuck, I don't want to be here. I'd rather not exist than have to go through this. So if you are a person, I'm going to take myself as an example, because I identify as non-binary, and coming to that term took me a long while, and I work a lot with mental health issues in the films that I try to do, I want to do, scratch that. The films I want to make, I talk about topics that I'm interested in, that are so personal to me, and part of that is mental health care. We don't talk enough about it, and in the Black community, we don't talk enough about it. We see that as a problem. It's hush hush, push under the rug, everything looks fine. And for years I grew up thinking that that was it. That me as a Black person, I needed to be strong. Me as a queer person, I needed to be even stronger. Me as a trans queer person, damn, it's exhausting to constantly feel like you have to be strong, because it's not gonna hold. And when you walk into that hospital, that healthcare, wherever it is, you want someone to just greet you as a human being. But rather, it's like there's this tug of war going on, where it's I am instantly met with aggression and this feeling of me having to defend myself. First, I'm telling you my pronoun, you're not listening. 2 seconds after I've corrected you, you're saying the wrong thing. That hurts. That makes me go inwards and feel like, okay, maybe I should just keep quiet. So you just keep pumping and pumping, and at the end of the day, the same healthcare that you've gone there for, you walk out just feeling completely unheard, unseen, belittled. And again, I went in to ask for help. I'm living without help, but more of an anxiety attack. And I'm like, do I go back? Hell no. I go home and I deal with this and self-medicate in whatever ways you can, because that is what works. The system that is there to help you doesn't work, which I think is really sad. And it's sad that they don't teach different skin colors, different skin tones at a facility that's supposed to be for everyone and all-inclusive, yet it's staggering. I still can't understand that is what is going on, because I do have a friend who works as a doctor, and I did ask her this. I was like, oh, when you get to do practice, do they bring other skin colors? And she said, no, never. And everywhere I go to, whether it's in cultural work or school, university, it's still the same thing. There are rarely any Black facilitators. There are rarely any people of color in a place that you're supposed to feel like everyone is all-inclusive. And so the minority stress piles up, because it's one thing after the other. It's constantly like a slap in the face, but everyone we don't talk about it.
Do you want to maybe define minority stress for people in the audience who maybe don't know what that is?
Oh, I would say pick your phone up and read that. I can't be, it's not my responsibility to teach what minority stress is, because that stresses me out, and
that's minority stress.
That is minority stress in itself. It's not my responsibility to have to tell someone how it feels like to feel not included, to feel alone in a room where you're supposed to be with your peers, where you're supposed to feel welcomed. Mm. I want to feel welcome. I don't walk up to someone who's white and say, tell me how stressful it must be for you to feel like you're the only white person in the room. How stressful it must be to grow up all your life looking for people who look like you. In a country where there are people who look like you, but they're not always there where you want them to be. Mm. You know, like like we said before, not every Black person identifies as queer, as trans, or whatever. No. So these rooms are really limited. Mm. So again, please pick up your phone, Google minority stress. If you have Siri, ask Siri, because Siri will explain better than I will.
Andy, is there something you want to add?
Yeah, but I can say like I mean, on the topic minority stress. I mean, if you run for me at work, it's like if you're running in one track, you have to jump over to the other track, and you try to run in both tracks, and then when you're there, when you're like in hamn, when you're framme, when you're at the goal, um, someone, I mean, I don't say this to explain it. I'm just saying how it is. It's like someone expect me to be just been running in one track, but I actually been running in two tracks. So I mean, that kind of, I mean, also the thing you talk about that you expect to be strong, but also as a healthcare professional, it's like you don't expect that person to have their own feelings, their own history and baggage, because you expect that person to be professional. And I think that is okay, but it is also to a certain limit, because we also need that self-care and community care and ways of reload. And if other people don't know where to go, where, I mean, I feel the same, where do I go? I mean, we can have, for example, group sessions or like leadership groups or etc., but that is probably not to talk about like how I feel as a black person receiving a situation, for example, someone being racist, or my colleagues being racist or homophobic or transphobic or whatever. I mean, that is that is meant to talk about if it happens something that we collectively need to talk about. So yeah, I think like just a lack of proper support is kind of the biggest problem. And I was also thinking about something that I just forgot. No, I remembered it now. Yeah, the thing that I want to talk about was also exactly lack of memory as a stress problem. So for me, coming here was kind of interesting, since I also on my way in the train got kind of attacked by the train crew, and which made me need to leave the train in Halmstad outside Göteborg. So like even when I go to a professional job and talk like this, I get attacked, and it doesn't matter if I'm like a nurse or if I'm like an academic or who I am. I mean, as a black person, you need to be ready for everything. You need to write. Yeah, you should even write the third track, because everything unexpected can happen. And what does that make with your mental and physical health? We didn't talk so much about it, but I just want to lift it up, like those words that came from probably like English-speaking countries, America, etc. Like weathering, excluding, or like how do I say, not utöver,
As well as, like, on
as
top
well
of.
as, yeah, whatever, yeah, thank you. Minority stress, which is such a big like word, is like it contains so much. But the thing of like, for example, weathering, which is a very interesting, that is a word that covers like the physical health problems you get from stress connected to minority stress. So I think like, I mean, there is a reason why black people in general can have less health benefits than white people or other ethnic groups, because of like, I mean, you get high blood pressure, you get high stress levels, which lead to can lead to like yeah, high blood sugar, more extra weight than you want, whatever. So all these kind of health problems that is physical is based on your mental health. So you are likely to die before other people because of that if you don't do anything about it, and it becomes your individual problem when it is a systematic problem.
I also think it's even harder to realize that it's happening to you, that you're going through something like this when it's a systematic problem, because you're constantly hypervigilant, which minority stress also causes you to be hyper vigilant. Like you said before, you have to be ready for whatever comes your way, and I think it's something many black people can testify to, many people of color can testify to this, that hyper vigilance that you go around carrying with you, ready for no matter what, especially if you're in a space where you also don't feel like anyone in the room has got your back, then that hypervigilance comes up even more. And I can attest to that. There's been so many events where I've just been on my own, not even saying anything, and I'm attacked verbally, physically, name it. And I also want to say, I'm so sorry that happened to you yesterday
Thank
on
you.
your way here. That must have been really awful. And I think I can relate to that in a way where I instantly, whenever I'm in a situation like that, I repress it quickly because it's something I'm so used to. And then when I get home, whether I want to or not, it starts playing back again, which again takes a toll on my mental health because I've done this shit. I've repressed a lot. I don't want to have to keep repressing. The box is full. You know, my brain is giving me warnings, memory overload, delete files. And I'm like, which ones do I delete? This repressed memories, and if you go to a place, there's a chance that the memory could come back, like flashbacks, and that also creates internal trauma, and you don't have a space to go to, to just vent out. So minority stress creates a lot of things, and with black people as people who don't talk enough about this particular topics, we need a forum in order to feel safe and be able to talk about mental health, queerness, transphobia, anything we need to talk about without fear of being attacked.
No, absolutely.
I think they want us to round up.
Yeah, okay. Like now,
get up.
like 5 minutes? Yeah, okay.
Run.
Okay, well, let's end on a positive note.
What is that though?
Yeah, it's another good question. What is it that we want to see different from healthcare? What is it that we want healthcare providers to know? What can a better future look like?
I think just I would really want someone, or like I would want them to address me as a human being with respect, to not assume someone's pronouns or gender, to look beyond whatever it is they've been taught in school, not everything, but like the negative things they've been taught in school, and just see me as a human being. Listen to me, call me by my name rather than what you assign as my pronoun. And when I tell you I have a problem, take me seriously.
Yeah.
Don't fucking tell me, oh no, you're just overreacting.
Yeah.
It's just a rash. It's annoying to feel like you've paid for something and not gotten the help that you need.
It's not too much to ask.
It's not too much, I just want respect.
Andy?
Yeah, I think like collaboration between like the police and the healthcare in a positive way. I mean, we're not gonna get rid of the police force. So I think like when things happening, everyone in the society needs to. If someone is getting beaten down, for example, they will be probably if the police comes. I mean, everyone needs to get that information about the situation for black people because I mean. It doesn't matter if only the healthcare staff were going through this education, but not the police, because I mean, or any other like facility in the society. I mean, everyone needs to get enlightened and get like common knowledge about like how to treat minority people and black people. So.
Yeah, it's time for people to get their shit together. Mm.
Get it together.
Yeah, on that note, thank you so much, Andy, Esse.
Thank you.
Yeah, thanks.
Thank you.